Good evening, everyone. Welcome to today's talk. Today, Ananya will be presenting on 1 year quality of life among post-hospitalization COVID-19 patients. Before starting, I will be introducing her. Ananya holds a master's in population studies from International Institute for Population Sciences, Mumbai, and a master's in geography from Vishwabharati University, Shantiniketan. Her academic journey has equipped her with expertise in demography, statistical analysis, GIS, and research methodologies, making her a valuable asset to interdisciplinary research initiatives. Um, Ananya, now you can go on with your presentation.
Okay, thank you for the introduction, Liatima. Good evening, everyone. Today I'll be presenting a research work titled 1 Year Quality of Life Among Post-Hospitalization COVID-19 Patients. So, COVID-19 has impacted the lives of millions of people and families around the world. And according to the World Health Organization, there were 210 million confirmed cases and 4.4 million deaths as per 2021 August. And this is also just what the data shows. The estimates greatly surpass these numbers. Most of the patients with the COVID-19 lead a normal life after acute infection, but some patients report ongoing health issues. The estimates and data for that are unknown, but some reports indicate that 10 to 20% of COVID-19 patients experience lingering symptoms. In October 2021, the World Health Organization defined long COVID as the presence of symptoms 3 months after the SARS-CoV infection, with a minimum duration of 2 months, which cannot be explained by alternative diagnosis. It represents a significant health challenge due to its high prevalence, its great impact on the quality of life, and the lack of knowledge about its cause of development, predisposing factors, treatment, and prevention. Long COVID can affect any organ system, including the peripheral and central nervous system, cardiovascular system, respiratory systems, or even the digestive systems. Previous studies reveal that rather than the severity of the disease, patient profile have a larger impact on the quality of life and the risk of disease, especially females with chronic fatigue, and to a lesser extent, people with obesity develop symptoms for long COVID. Therefore, the study seeks to explore how a patient profile affect the quality of life. And the authors of this study developed the hypothesis that long COVID would be more influenced by a certain patient profile than by the severity of the acute infection. The aim of the study is to assess health related quality of life 1 year after hospital admission due to COVID infection and the factors that may influence it. The following study has been performed in the city of Castellón, Spain, and it is a retrospective observational study which took place between March 2021 to February 2022. There were 486 participants and who were aged 18 years and above, and these participants were admitted in hospital for COVID infection during March 2022 and March 2020 to February 2022, and their cases were confirmed through RT-PCR or antigen tests. The variables undertaken to determine the quality of life are demographic variables, medical history, clinical outcomes, laboratory test results, treatment, and vaccination. The demographic variables include age and sex. Medical history includes comorbidity, which further includes obesity and body mass index, and Charlson comorbidity index, where higher score indicates higher morbidity, higher comorbidity. For the outcome variable, the 36 short form survey on health related quality of life questionnaire was undertaken. The SF36 evaluates the quality of life through 8 domains, namely physical functioning, physical role, bodily pain, vitality, social functioning, emotional role, and mental health. For each domain, higher score indicates a better quality of life in that particular domain. The statistical analysis in the study was performed using SPSS. It is a descriptive study where the quantitative variables were described through means and medians, and the qualitative variables were described through absolute and relative frequencies. To test the associations between the outcome variable, that is SF36, and the quantitative variables, Pearson correlation was performed, and for the associations with qualitative variables, Mann-Whitney U-test was performed. Further, to correct multiple comparisons, Bonferroni test was performed, and finally, a multivariate analysis was performed between relative explanatory variables and the quality of life using multiple linear regression. As per the results, these are the quantitative variables that are found to be significantly associated with some domains of SF36. So variables like age shows worse outcomes for physical functioning, and Charlson Comorbidity Index shows worse outcomes for physical functioning and general health. These are the qualitative variables that are found to be associated with SF36, and they were included in the multivariate analysis. Uh, Female sex continued to show significant and negative association with all domains of SF36. Chronic fatigue showed negative associations with physical functioning, bodily pain, general health, energy, and emotional role. Obesity has a smaller influence and found to be related to worse outcomes in physical functioning and physical role. So, the worst quality of outcome was obtained in the domains of general health, vitality, and mental state. And according to the study findings, hospital admission for the disease produced a long-term deterioration in quality of life. It is observed that quality of life is in practically all domains is especially compromised for a specific patient profile, that is among females, people with chronic fatigue, and to a lesser extent, people with obesity. And in contrast, the severity of disease did not appear to have an impact on subsequent quality of life. Other determinants like age and age adjusted Charlson Comorbidity Index were also associated with worse outcomes, although in multivariate analysis, age maintained its negative effect on physical functioning, and age adjusted Charlson Comorbidity Index showed negative outcomes on physical functioning and general health. Analyzing the impact of psychological and psychiatric conditions and not just the physical aspects on the quality of life is one of the major strengths of this study. Moreover, reporting lab results during acute infection and analyzing the use of corticosteroids are some of the other strengths of the study. The retrospective nature or the lack of estimation of size calculation is one of the limitations of the study. The absence of control group, or as well as the lack of reference or expected values of SF36 test for a population similar to ours, limits the study scope for better analysis. Finally, as included patients were infected in the early stages of the pandemic, the protective effect of vaccination prior to infection could not be assessed. So, in conclusion, patients who required admission for COVID-19 in 2020 and early 2021 continued to show diminished quality of life 1 year after hospital discharge, especially in the domains of general health, vitality, and mental health. The main factors that may influence this would be female sex, a history of chronic fatigue, and to a lesser extent, obesity. More data are needed to evaluate the role of inflammatory response and specifically serum ferritin in it. Thank you.
Thank you, Ananya, for your presentation. Now the floor is open for Q&A session. Please put your questions in the chat box. Okay, I see no questions. So now we can conclude the session. Thank you once again, Ananya, for your wonderful presentation.
Thank you
Um,
so much.